So how do we treat these women? Besides acupuncture, because Jessica's going to go over that, but I always start by telling patients diet and exercise and weight control are important. Obviously, if they don't want to get pregnant, you want to put them on contraception because it keeps their period regular. Skincare, obviously, if they have hirsutism, you can address that. Emotional care, it's a distressing disorder for some patients, so it's important that they need help with that. So metformin, somewhere between 1,500 and 2,000 milligrams a day is what's recommended. Birth control pills, again, if they're not trying to get pregnant, or if they have hirsutism or hair growth, you can add other medications such as spironolactone and flutamide. Spironolactone is the most commonly used. And if they do want to get pregnant, we usually treat them with Clomid or shots or IVF, and we'll talk about those each. So weight loss, so that's important. The more they lose the weight, the lower the insulin, and they become more insulin sensitive, less insulin resistant. They also have less level of androgens. If they lose some weight, they have an increase in SHBG level. Remember, this is the one protein that's important for binding the testosterone hormone. So if you have less free testosterone, you have less hair growth overall. It also helps them resume their periods, and they can result in spontaneous pregnancies. I've seen so many patients. I actually work at the county hospital once a week, and we have patients with body mass index of over 50 sometimes who come for fertility treatment, and we tell them, we won't treat you with Clomid until you lose a certain amount of weight, and they do, and they get pregnant on their own without even treatment. So really only 5% is required. We recommend 10% usually of weight loss. And in terms of hair growth options, oral contraceptives actually do help with the hair growth, again, through SHBG, sex hormone binding globulin, which the birth control pills increase by acting on the liver. And they also help by decreasing through the pituitary gland LH and FSH stimulation, so less androgens are produced. Spironolactone is another medication that we sometimes add to birth control pills to help bind that extra testosterone, and I've seen improvements with this. Finasteride, flutamide, I've honestly never prescribed. There are a lot of liver toxicity studies on these, so very rarely used. And GnRH agonist is for extreme circumstances. I've never used it for this reason for patients that's basically just kind of shutting the whole system down. And but it has been studied for this. So again, birth control pills and plus or minus spironolactone are the most commonly used. So how do you treat infertility for these patients? Again, this is what I do a lot of. We see a lot of PCOS patients with infertility in my practice. And this is the one time that I think clomiphene citrate should be used, because unfortunately I do see a lot of patients who are using Clomid for the wrong reasons with regular periods, and it just doesn't work in them. And again, I do add metformin if they're resistant to Clomid or if they have insulin resistance. And if Clomid doesn't work, we move on to the next step, which is fertility shots, fertility medications, which are called gonadotropins. But you have to be very careful in polycystic ovarian syndrome patients because they respond nothing, and then boom, all the eggs can grow at the same time. So you have to be very careful not to get hyperstimulation. And again, metformin can help. Now, in the old days, before they had metformin and before there were lots of studies, they used to do something called ovarian wedge resection, which is like kind of cutting a piece of the pie to reduce some of the stroma in the ovaries, or something called ovarian drilling, where they actually just take a little bit of electricity laparoscopically and just make little holes in the ovary. And the thought behind that is that basically it breaks up some of the stroma and it improves, basically kind of kickstarts ovulation. The problem with that is that some people get ovarian failure because you're kind of burning the ovaries. So we don't recommend that in this country. I just saw a patient recently who had it done in India, and I was looking at her video and I was like, oh, you just see the burning of the ovaries and it hurts. And obviously last resort is IVF. And Clomid, just to go over a little bit, also known as clomiphene citrate or seraphine, is a pill. And you take it, it is FDA approved for ovulation induction. And you take either 1 or 4 pills a day, although I rarely have used more than 3 pills a day. It either works or doesn't. 4 pills a day doesn't work if 3 don't. You take it for 5 days, starting on day 3, 4, or 5 of the cycle. And usually, if people are going to get pregnant on Clomid, they do so within 4 to 5 cycles. And really, there's been studies that nobody gets pregnant after 8 cycles. And I can't tell you how many times I've seen patients who are on Clomid for like 2 years or 3 years before they came to see me, and it hurts.
You did a wonderful job of explaining what goes on through your body, Western medicine-wise, and So now, on this part of the lecture, I'm going to talk about Chinese medicine, what we do, how we treat PCOS, and how we view PCOS. So I'll also give you a little background on, she already explained this, so we're not going to go over it. But pretty much with the pictures, this is a more animated picture. You can see that your ovary with little strings or pearls, they call it, at the end is what your ovaries look like if you have a polycystic ovary. So acupuncture has been treating PCOS for a long time, and it hasn't been recognized as strongly to treat PCOS because there has been actually a lot of studies on acupuncture and PCOS, but a lot of them are actually non-randomized. If you have a randomized test, it actually creates a more valid test. But it is also really important to look at, and actually clinically, myself and our other practitioners at Wellness, we definitely treat a lot of patients with PCOS with relatively pretty good success. One study done, electroacupuncture reduces the testosterone and improving the ovulation. They did a treatment 4 months with 84 patients, ages 18 to 39, and then compared a group who did electroacupuncture and a group who did electroacupuncture and exercise, and a group with just exercise, and a group with no treatment. And they actually found a significant difference with the group who actually just did electroacupuncture to induce ovulation. And electroacupuncture, what it is in that little picture, is acupuncture in itself. When you place the needle in certain areas of your body, it communicates to your brain. It taps into your central nervous system. When you connect it with the electrostimulation to the needle, actually creates a stronger vibration. So it's, instead of me sitting there just stimulating the needle and tiring myself out, I become lazy and I use the machine for it instead. So it depends also on different frequencies that you use. So another study by Steiner and Victor, and she also tested, this actually was a smaller study of 24 people. She also tested to see, did electroacupuncture on patients who were not ovulating with PCOS. And also studies have shown that acupuncture also helps with ovarian hyperstimulation, like Dr. Deugarte was mentioning, that does happen with patients who have PCOS, and acupuncture does help with these symptoms. And of course, treatment, nutrition, I think with Western or Chinese medicine, the first line of treatment for PCOS is really nutrition and lifestyle and exercise. That's really the most important. And lifestyle, exercise, acupuncture, and Western medication, like Dr. Deugarte talked about. So let's talk about that a little bit more. So Hippocrates says, "Let food be thy medicine, and medicine be thy food." And to me, I hold on to that as a holy grail because I think food, nutrition is so important in any part of any disease, any pathology. Because especially with PCOS patients, in my own experience, I've seen patients that just changed their nutrition and actually exercise more. They're able to shift. They're able to make some changes in their body, actually make a difference. They get their periods back regularly, without having to take medication sometimes, or they've been on birth control for a very long time, and sometimes they want to get off of it. So you shift their diet, their exercise, and of course, acupuncture and herbs. But sometimes if it just doesn't do anything, then you go for medication. So in nutrition for PCOS, we really want to talk about more of an anti-inflammatory and insulin balancing diet. So what I mean by insulin balancing is, like Dr. Deugarte said, we don't really know what the cause of PCOS is, but we do know somehow that it's connected to our insulin level. And what you want to do is make sure that you're eating at regular levels, so your insulin level isn't peaking up and spiking up and down, causing a little havoc in your system if your body is already sensitive to that. So what you can do to keep your blood sugar balanced is giving your body a regular time to eat, eating at regular time intervals. So making sure you're eating breakfast, lunch, and dinner. and having a few snacks in between. That actually could help you level off your insulin level. And you want to make sure whenever you're eating some sort of carbohydrates, you're balancing it with a protein. So a good snack idea is, let's just say if you want to have celery stick, mix it with some almond butter, cashew butter, or pecan butter. And you could also have hard-boiled eggs as your protein. Also, if you're having berries, add nuts in there. Lifestyle and exercise, also very, very important. So one thing to do is to get moving. You gotta, even like Dr. Deugarte said, even 5% of losing weight or getting regular actually really helps you ovulate. Women actually, I've seen plenty of women who are not overweight, who actually are on point, but they need to exercise a lot, because if they don't, they actually start gaining weight. Because I look at them, I'm like, gosh, you look great, but at the same time, if they know their body, if they didn't start exercising, they don't lose weight, and they don't get their period. So they actually, unfortunately, have to work a little bit harder than normal. So get a friend, go for a walk, go for a hike, go for a bike ride. I want you to move like you're a kid again. Exercising doesn't mean going to the gym and hardcore, running or anything. Mile jogging. Okay. So not only is this good for PCOS, but also good for your life and your health in general. And also getting enough sleep is so important. There's a hormone that regulates our sleep called leptin and ghrelin. What it does is when we don't sleep enough, those two hormones regulate how our body recognizes if we're full or if we want to eat. So let's just say if you didn't sleep enough one night, the next night you usually find yourself just hungry all the time. Nothing could satisfy. You kept on munching. It's like, why am I hungry? I eat enough. I had enough food. It's because see if you had enough sleep the night before. Okay? Because you want to make sure that you're sleeping well, because it helps. Studies have shown that if you sleep well, it helps you lose weight. But it doesn't mean for you to sleep 10 hours, 15 hours a day, and then watch your weight come off. It doesn't work that way, obviously. So this slide, I want you guys to take a moment to just kind of feel how you're feeling right now. Okay, just be present, and then just feel, kind of get in touch with your emotions and see how you're feeling right now. And now we're gonna laugh. Like laugh, real laugh. And it sounds funny when you laugh. You're like, how do I make myself laugh? Literally, I just went, and I just laughed. And you actually literally have to train yourself to laugh, and it's such a great exercise, because when you laugh, it actually helps your body release all that cortisol, all that stress, all that inflammation out of your system. Okay, when you do that, and actually, look, I see so many more people smiling right now. Like, how do you feel? How did you feel after you laughed? Like, good, right? You feel relaxed, even though it was a little silly, but you felt like, oh. It decreases stress. It releases all sorts of chemical reactions in your brain to release good chemicals, endorphins. So when you laugh, it's good. So you don't have to wait to see other people laugh, or look at funny, or read funny jokes, or watch funny movies. Once a day, make yourself laugh. Because it will definitely relax you more, and will help you make your body function a lot better.